G'day, it's Dr. Joss again. Just wanted to update you with the Bundaberg situation. So we're now up to a total of 18 cases in the Wide Bay region. I'm not sure how many of those are specifically in Bundaberg, but I can tell you that all of those cases, all those 18 cases are international travel cases. So there's been no community transmission yet in our Wide Bay region, which is a good thing. And if we look at the national numbers too, in particular the rate of new infections each day. So last week the increase in number of cases each day was between 25 and 30%, which was tracking along, if we're looking at the curve, that's similar to what Italy and China were in our early stage. And all our social distancing and attempts to flatten the curve have actually started to work. So over the last 3 days, the average increase in number of cases is down to 9%, which is a huge difference. And definitely says that what we're doing is working, means that we need to continue doing what we're doing. But it's a pat on the back to the citizens of Australia that have been doing what has been recommended and also enforced by the government as well. But it's starting to make a really big difference, which is a good thing. And so I can confirm that currently in Wide Bay there's no community transmission, which is what we want. As soon as there starts to be community transmission, that's when we start to lose a little bit of control over the increase in the number of cases. So far we're doing pretty well. And the other thing is testing. So we are testing, Australia is one of the highest rates of testing in the world. And because of that, a lot of our stats actually look lower in terms of infection rates and hospitalisation rates compared to other countries. So our hospitalisation rate is somewhere between 1 and 2%. Whereas in other countries it's as high as 10, or even, I think in Italy it's 1 in 3 people are hospitalised. But that's because of the number of tests that they're doing. So if they're not catching all the cases, then the actual percentage is a bit skewed. So because we're testing so many people, we can say that we're only hospitalising 1 to 2% of cases, which is also a good thing. So I think as a whole, Australia is doing really well so far. We really need to keep going the way we're going. It's not a opportunity to relax and go back to how it was. Otherwise it's going to just get worse again, but we need to keep going with the way we're going. So please keep staying home, stay safe. And I've got an interview potentially with a specialist in town later in the week, just to talk about some specific circumstances. So looking forward to doing that. But I'll let you know more about that a bit later. See ya.